Hi friends, let us know about the surgical procedure before going for cochlear implant. A cochlear implant is a surgically implanted electronic device that provides a sense of sound to a person who is profoundly deaf or severely hard of hearing in both ears. As of 2014, they had been used experimentally in some people who had acquired deafness in one ear after learning how to speak. Cochlear implants bypass the normal hearing process. They have a microphone and some electronics that reside outside the skin, generally behind the ear, which transmits a signal to an array of electrodes placed in the cochlea which stimulate the cochlear nerve. The procedure in which the device is implanted is usually done under general anesthesia. Risk of the procedures include mastoiditis, otitis media, acute or with effusion, shifting of the implanted device requiring a second procedure, damage to the facial nerve, damage to the chorda tympani, and wound infections. People may experience problems with dizziness and balance for up to a few months after the procedure. These problems generally resolve, but for people over 70, they tend not to. There is low to moderate quality evidence that when cochlear implants are implanted in both ears at the same time, they improve hearing in noisy places for people with severe loss of hearing. There is some evidence that implanting cochlear implants to improve hearing may also improve tinnitus, but there is some risk that it may cause people who never had tinnitus to get it. There is controversy around the devices. Much of the strongest objection to cochlear implants has come from the deaf community. For some in the deaf community, cochlear implants are an affront to their culture, which, as they view it, is a minority threatened by the hearing majority. Surgical procedure. The surgical procedure most often used to implant the device is called mastoidectomy with facial recess approach. If a person's individual anatomy prevents MFRA, other approaches such as through the suprametal triangle are used. A systematic literature review published in 2016 found that studies comparing the two approaches were generally small, not randomized, and retrospective, so were not useful for making generalizations. It is not known which approach is safer or more effective. The procedure is usually done under general anesthesia. Risk of the procedures include mastoiditis, otitis media, acute or with effusion, shifting of the implanted device requiring a second procedure, damage to the facial nerve, damage to the chorda tympani, and wound infections. The rate of complications is about 12% for minor complications and 3% for major complications. Major complications include infections, facial paralysis, and device failure. To avoid the risk of bacterial meningitis, which, while low, is about 30 times as high compared to people who don't undergo cochlear implants procedures, the FDA recommends vaccination prior to the procedure. The rate of transient facial nerve palsy is estimated to be approximately 1%. Device failure requiring reimplantation is estimated to occur in 2.5 to 6% of the time. Up to one-third of people experience disequilibrium, vertigo, or vestibular weakness lasting more than 1 week after the procedure. In people under 70, these symptoms generally resolve over weeks to months, but in people over 70, the problems tend to persist. Cochlear implants are only approved for people who are deaf in both ears. As of 2014, a cochlear implant had been used experimentally in some people who had acquired deafness in one ear after they had learned how to speak, and none who were deaf in one ear from birth. Clinical studies as of 2014 had been too small to draw generalizations from. Thank you.